is definitely missing in healthcare. Access to complete information. Now, this is where if you go and the patient is admitted in ICU, you are not allowed to see or refer day-to-day sheets in the most of the hospital. They'll say once the patient is discharged, we'll hand over everything. The doubt element starts there. The minute you hand over everything to the patient, then naturally I'm comfortable. I tend to think that yes, they're willing to give me everything, they're transparent. Now the errors are, they're left to, chance. Again, I agree with Mr. Anand Padmanabhan that entire record, it's difficult. There is an implementational challenge in terms of recording everything that doctors or nurses would write otherwise. Mindset issues and change management is a huge task. But nothing stops us from capturing complete information generated by the equipments because it's already digitized. But yet there we need to, I'll show you in the other slides what can be done there. Counseling and informed decisions. That is one more step to bring patient closer to the practices and keep them informed. And evidence-based medicine, which I'm very bullish about. I think Mr. Alam Singh will talk more about it. I could read his session sometime later during the day is there. So the patient gets comfort saying that it is not an individualistic opinion. We are taking collective opinion, from evidence-based medicine, and you are getting the best possible treatment established in that particular demography. So status updates, very simple things, such as a patient is admitted in ICU, I'm not allowed to go in for in the sterile area. Simple video conferencing will reduce the anxiety, right? If I get to see the patient at least twice a day, myself, my own eyes, I'm comfortable. Status updates on mobile, such as if I prescribe pharmacy, it's the hospital's own pharmacy. The prescription can go automatically to the pharmacy. When the packet is ready, I can get an SMS and pick it up. Mostly for OP patients, there is no great emergency of picking the medicine right away. But there is no other choice, so people queue up there. Status updates about critical test results and reports, very essential. Status update about that payment limit, the insurance limit is approaching, very important alert. So all these status updates can very easily be communicated. Access to complete information, I still wonder, we have all digital equipments, they all give independencies. You go and have angiography, cath lab will produce, console will produce a different CD. CT scan examination, a different CD. Right? A patient faces a lot of difficulty in terms of going, collecting and remembering and producing right CD at right time. When everything is digitized, why can't it be a single CD where, like I've shown, right from digital ECG data, path lab reports, everything can be given in one single CD. Today's DVD is more than enough to accommodate entire diagnostic detail, including images, objective data, waveforms, clinical reports, everything. But this is not done. Counseling, yes, I feel that images speak better than 1,000 words. I have seen, personally, wherever I implemented the system, I give this recommendation to doctors that any sort of PACS system or image archive system should not be confined only to diagnostics. The main benefit, like counseling, can be derived by consultants, those who counsel the patient. So suppose if there is a proximal LAD failure, coronary failure, and then I have to convince the patient that how CABG, that is open heart surgery, will be better than angioplasty. If I can pull out data of last 10 cases where I've shown that this is a similar problem, similar profile, diabetic patient, stenting was used, it did not last after 5 years. Other 5 cases where CABG is still proving right, I can go for that option. So we have not thought of such applications of standard data, which is PACS data. It typically goes to a diagnostic consultant and remains stored. So such things should be incorporated. I think there were many more parameters. I mean, let's not go into patient privacy because that's also one sensitive area. But I've not gone into other areas. I've just said that how that anxiety can be lowered. I'm sorry if I have overshot the time. Thank you so much. And any questions?